Welcome to ORF Digital Conversations. As always, before I get to my guest of the day, a small note for our viewers. Please subscribe to ORF's channel on YouTube to get such curated content on your timelines. The total number of coronavirus cases in the US has now surpassed the 1 million mark. The total number of deaths has now surpassed the total number of Americans that died during the Vietnam War. Many attribute this untoward scale of impact in the US to continued American polarization and partisanship, even in face of a health crisis. For more on this, today we have with us Dr. Leslie Winjamuri. Dr. Winjamuri is the Dean at the Queen Elizabeth Academy of Leadership in International Affairs and Director of the US and Americas program at Chatham House. Thank you for joining us, ma'am.
Thank you, Kashish. It's an honor to be speaking with you.
All right, so let's start with America's response on the global level. Do you think this pandemic is going to be the final blow to the crumbling consensus on American internationalism?
It is the question that people are so curious about. They're so worried about. The rest of the world is deeply concerned that the US hasn't really provided the leadership role that it normally has in the past. It hasn't provided any degree of certainty and predictability. There's been a lot of back and forth and also, undercutting of the role of some really key institutions, the IMF, the World Health Organization. There are clearly concrete and somewhat legitimate concerns that the US has with any number of specific issues on the agenda. But that's often been the case. And what we really need to see is clear internationalism. Now, in terms of where America's heading, I think it's very much in play. If you look at the public opinion polling, Americans, the majority of Americans still believe in US leadership. They think it's critical. But of course, the devil is in the details. And one thing I think that we're all waiting for is what happens in November, where the elections take us. I think if we see a change in administration, there will undoubtedly be a very different approach to international relations. And I think then the question is, how will the rest of the world receive that? And my guess is that actually, given the scale of the pandemic, of the health crisis, of the economic crisis, that there will be considerable appetite and willingness to work quite considerably with the United States through the multilaterals, through bilateral relationships. But it's a long time between now and January, when a new administration might possibly come in. And at the moment, what we're seeing is the US very much internally focused, really trying to cope with what you mentioned was just dramatic scale of the coronavirus, of the COVID-19 deaths, and of this entire question that's really preoccupying America right now, which is when and how to reopen the economy.
Right. Speaking of change, American political economy during this crisis seems to be shifting further to the left. Now there's bipartisan support for unemployment insurance, for even stimulus checks for individuals. Do you think this move to the left is momentary, or are we witnessing a watershed moment?
We are witnessing a watershed moment. I think, we know this, right? When you have a global shock, a national shock of this scale, this is generally the moment when you see radical change, when you see people come together to respond to something that it's deeply necessary to respond to. Just the numbers, the economic devastation, the supply shock, the demand shock, the need to keep the economy going, it really calls for the state. And so I think that's what's really driven a very unusual level of bipartisanship, given how deeply partisan American politics have been for the last 3.5 years and even before that. So this question that you so wisely ask, whether this will stay with us, the effects of the pandemic are going to stay with us for a very long time, certainly for 2 to 3 years. And then by the time you move through that, right, you move through the health crisis, which will stay with us from some time, and the economic crisis is purely driven by that. That will lead to new coalition building, a new set of expectations by the American public. And I think it really puts the question of healthcare on the table in a very dramatic way. That's obviously been the top 1 or 2 priorities for American voters. And now it is clearly going to be right up there at the top. And the demand, I think, for access to services, for preparedness on pandemics, for healthcare, will make it very difficult for any leader and for Congress to push back against that desire to have the state play a much more active role. But I guess the other thing, and you're very aware of this, I know in your own thinking and research, that it's a very complicated question in America because the central government holds some of that authority and the states hold a lot of that authority. And then we have public attitudes. And even though there is this movement towards looking to government, looking to the state, there are deep problems. There's like lack of trust in government. And there are still people that, the pandemic is hitting people differently. It's hitting different demographics. And that trade-off between economic health and medical health, public health, if you will, is one that people evaluate very differently in part, due to the resources that they have to protect themselves, their families and themselves economically, and in part, depending on how the pandemic actually strikes them.
Right. You mentioned federal versus state responses. On that, President Trump has flip-flopped a bit. I mean, he has said that he's willing to defer to the states when it comes to their decisions to lift lockdowns. But at the same time, he has supported anti-lockdown protests in states that are controlled by Democrats. Do you see Trump's political arithmetic on the 2020 election featuring in this inconsistency?
Yeah, I mean, this is a president who, for his entire time in office, has been very savvy. We can decide how we feel about that, but he's been very savvy about speaking to many different audiences. So he speaks to his cabinet, he speaks to his base, he speaks to corporate America, he speaks to Silicon Valley, and he does this quite masterfully, and with very significant consequences, far from all positive, right, in the course of any particular speech. And this is why we'll see him say, you must wear face coverings, but actually I won't, because he's signaling, right? He's signaling to those who want to hear that, who want to hear him push back against experts and elites in the system, and kind of buck the trend. And the problem, of course, now is that the consequence attached to saying to states, yes, you must shut down, or you can make your own decision, but then kind of inspiring the protests that we've seen over the last few weeks. The consequences are so devastating because the direct results, the purpose of the shutdown, as we all know, has been to flatten the curves, to make it possible for hospitals to cope with the number of sick people and those who were really in very grave health circumstances. And when you have a president that's not really, it's one thing to delegate official authority, but the trust and the clarity of the message really hasn't been coming from the president. So, on that opening up question, we're seeing really very different positions. Some of that's linked to how the impact of the pandemic has played out on the West Coast as opposed to the East Coast. And some of that is linked to partisan politics. And the president really isn't bringing it together to produce a coherent message, a coherent approach. And that's the consequence is very, very dramatic.
Right. Speaking of the lack of a coordinated national response, in a recent article of yours, you argued that federalism and a sense of competition between states is a natural core component of American political fabric. This crisis has shown the downsides of that. As states compete with each other for medical equipment and supplies, some states are even coordinating with foreign nations directly to get medical equipment and supplies. In your view, was this the cause or the result for the lack of a coordinated national response?
Yeah, I mean, there's different parts of it, right? In theory, as you know, right, the U.S. system is meant to really balance that authority, that power between the federal system and between the states. And some of that's very productive because America is a very large country, not only in terms of its population, but in terms of its geography. And it allows states to have a real sense of the very different constraints that their people face and to respond to that. So investing authority in the states can be, allows for innovation, it allows for careful attention to local populations. It's very, very important. And I think for Americans, it's absolutely vital not to be, have everything controlled by the center. And there, and any number, this has worked not perfectly, but it's balanced innovation, localism, and central authority quite well for a very long time. The problem now isn't just the federalism, it's that the center's not working with the states and the message is not clear and the politics are being played. And so on certain things, you get a lot of innovation, you get states choosing when to lock down. But on other things, we do need the coordination, right? We need prices to be set. We need coordination of the allocation of personal protective equipment that's taking care of our frontline workers, our healthcare workers. And we need those ventilators very clearly sent to the states that most need them, to the hospitals that most need them. And the central government, Washington really hasn't played that role. And that's why we're seeing this competition. We're seeing prices driven up, but we're also seeing some very productive things in the US, right? The level of innovation and the drive to secure and to trial vaccines, to trial passive vaccines, active vaccines, as well as medicines that can relieve and alleviate the pain of those who are already suffering from COVID-19. There's a lot of dynamism. There's a lot of transnationalism. There are many, many international networks. But I think what we're seeing is that Washington is getting in the way too often rather than really facilitating, coordinating, managing, allocating, and really inspiring trust in government. If you get the trust, if you get the people to really trust you, that they believe that you're predictable, they believe that you're leading from the facts, that you have their best interests in mind, they're much more likely to comply with the things that you're asking them to do. And the things that Americans and frankly people across the world are being asked to do are extremely difficult. They're extremely painful. They have a high price, and you've got to have people believing in you if they're going to follow you.
So I'm guessing this is not going to lead to a rally around the flag Kumbaya moment between Republicans and Democrats anytime soon, right?
I'm not so sure about that, Kashish. I mean, I think this is a very interesting question. There are many, many Democrats and there are many, many Republicans that have the same basic belief, and they have the same basic commitment, and they have the same basic aspiration, which is to help the United States recover, to respond, and then to recover from the health crisis and from the economic crisis. Americans take their way of life, their standard of living, their economic productivity, and their individualism incredibly seriously. And that is not a partisan issue. And so I think that when you have this kind of crisis, the scope actually for moderate Republicans, moderate Democrats to come together and expect more of their leaders, I think we will actually see more of that than you might expect. I think that the problem is probably, with that base that at some level still don't fully believe that the trade-off, the economic trade-off is worth the cost for responding to the health crisis. That might shift. If more people in that base become affected directly by the health crisis, attitudes may well shift, and that will drive more of a consensus, and I think potentially more bipartisanship. So I think it's hard to predict how this plays out, but I do have faith in humanity, faith in people, faith in Americans, that people at the end of the day, they want good health and they want to be able to feed their children, feed their families, and have productive societies. And as this crisis goes on, people will be looking for very clear solutions.
Great. All right. On that note, thank you so much for joining us, ma'am. On behalf of ORF, we hope you and your loved ones are staying safe. Thank you so much for your time.
Thank you. It's been a pleasure to speak with you. I hope we speak again.
Thank you.